Well, the GAO confirmed exactly what we were expecting. And another example is that one Social Security number was used 125 different times. So as we expected, there's probably $35 billion of fraud.
This video is going to shock the crap out of you, especially on the heels of the Democrats shutting the government down for over 40 days, saying that they were fighting for health care, trying to get the Obamacare subsidies. Now, there's a department. It's an independent department. It's called the Government Accountability Office. It was established in 1921. So it's not some like partisan right wing or left wing. As a matter of fact, it's one of the actual independent agencies in Washington that doesn't care about party affiliation. They're just going to bring you the truth. And what has happened has blown the lid off the Democrat slush fund. See, we thought when we stopped USAID that we stopped the Democrat slush fund. Nope. What's been exposed is that the Democrats have been using, allegedly, Obamacare as a slush fund to be able to funnel in billions of dollars and use it for all type of propaganda things and a lot of these left-wing radicalization of citizens. That takes money to run these campaigns. That takes money to pay these fake protesters to tear up stuff and act like they're just outraged and against Trump, when really they're just unemployed people or senior citizens or illegal immigrants out here getting paid to be destructive. But the Department of Government Accountability, the Office of Government Accountability, they found $21 billion in Obamacare fraud. You might say, well, Brian, we know about that, but what if I told you that's only for 1 year? That was only for the calendar year from between 2023 and 2024. So that 1 year, they found 21 billion. Some estimated reports say it could be as high as 600 billion over the last decade, allegedly. So in this video, I'm going to let you hear how Obama's legacy has been destroyed. But before I do that, we hear a lot of politicians talk about Obamacare and whatnot. What if you could hear from the architect, the individual who created it? And wait till you hear. He's going to say out loud exactly what they did. As a matter of fact, they tried to scrub this video, as every time he was asked about it, he would lie and say, oh, I didn't mean that, until they got him multiple times telling the same story, which means they did this intentional. His name is Jonathan Gruber. Let me show you who he is. Jonathan Gruber, he's an economist, and he's an American professor of economics at the Massachusetts Institute of Technology, where he taught since 1992. He's also the director of the healthcare program at the National Bureau of Economic Research, where he is a research associate. Let me get here to the most important part. He has been described as a key architect of both the 2006 Massachusetts healthcare reform, sometimes referred to as Romney Care, and the 2010 Patient Protection and Affordable Care Act, sometimes referred to as ACA and Obamacare. So this is the architect. I wanted you to see that. Now, I want you to check out this video and listen to what he says. And I want to know what you think about it after you hear this. Check this out.
You just literally cannot do it. Okay, transparent financing, unless I have transparent financing, also transparent spending. I mean, this bill was written in a tortured way to make sure CBO did not score the mandate as taxes. If CBO scored the mandate as taxes, the bill dies. Okay, so it's written to do that. In terms of risk-rated subsidies, if you had a law which said healthy people are going to pay in, it made explicit that healthy people pay in and sick people get money, it would not have passed. Okay, just like lack of transparency is a huge political advantage. And basically, call it the stupidity of the American voter or whatever. But basically, that was really, really critical to get anything to pass. And, it's the second best argument. Look, I wish Mark was right. We can make it all transparent, but I'd rather have this law than not. So it's kind of like his reporter story. Yeah, there's things I wish I could change, but I'd rather have this law than not.
So first of all, you haven't publicly commented on this so far. Do you stand by the comments in that video?
The comment in the video were made at an academic conference. I was speaking off the cuff. And
another Massachusetts hero, John Kerry, from Vermont, were like the SAS, came up with a great substitute idea. They said, look, what you economics nerds want to do is you want to say that for people with expensive health insurance plans, they will no longer get a 40% tax rate. What if we instead just levied a 40% tax on the insurance companies that sell these terrible expensive Cadillac plans? We said, well, that's pretty much the same thing. So why does it matter? They said, you'll see. And they were posted in that passed. Because American voters are too stupid to understand the difference. So basically,
I was speaking off the cuff, and until the second Massachusetts hero arose, John Kerry. And John Kerry said, no, we're going to tax your health insurance. We're going to tax those evil insurance companies. We're going to impose a tax that if they sell health insurance that's too expensive, we're going to tax them. And conveniently, the tax rate will happen to be the marginal tax rate under the income tax code. So basically, it's the same thing. We just tax the insurance companies. They pass it on higher prices. That offsets the tax break we get. It ends up being the same thing. It's a very clever
basically exploitation of the lack of economic understanding of the American voter. Okay.
And so speeding off speak.
So, in other words, if you heard this man, he literally said they put in tricky language. I'm just breaking down, paraphrase. They put in tricky language, and as opposed to what Democrats love to do, which is increase taxes, as opposed to doing that, now we'll just, call it a penalty, or we'll start telling them that we're going to tax the insurance companies. That's what we're going to do. That's what they said out loud, but the way it was worded inside of the bill actually made it where, okay, insurance companies, and they coordinated with them. Hey, listen, we're going to say we're taxing you. All you got to do is increase your prices and recoup. So in essence, the Democrat Party has been using the Obamacare or the ACA, whatever you want to call it, as another way to tax Americans. And you heard the creators say it 3 different times. So when they try to act like, oh, they're just bleeding hearts for people and health insurance, no, they're not. The Democrats love taxes, and they knew you couldn't come to the American people and say, hey, we want to slap another tax on y'all. They got creative. And they're wicked. And you heard this man say, yeah, no, he don't like transparency. The advantage that they had is lack of transparency and Americans being stupid. And this is why I always say, if you watch my videos, you've heard me say it. The Democrat Party wants and needs ignorant voters. If their voters are intelligent, nothing that they present will ever fly. They have to lie, they have to manipulate, and they need to dumb people down. Would it be crazy? Would you think it was crazy if I told you that the reason why I believe the Department of Education was instituted? If you're enjoying this video, do me a solid, hit that thumbs up, because I will never ask you for a cash app, a super chat, or a donation. But you hitting that like button and then hitting the hype button if it's there really helps the channel. And if you aren't subscribed to the channel, subscribe. And once you do, make sure you hit the notification bell and select all, so YouTube will make sure that you get notified when I upload new videos. Because prior to the Department of Education, schools were great. Students were doing much better. You put in the Department of Education, and there's been a steep decline. You know why? And that was instituted by a Democrat president. You know why? Because they had to take control of the education system to dumb people down in high school, even people at colleges. Luckily, I got out of college in the early 2000s, and even then, the trend was starting. But now, you can go to college and get a 4-year freaking degree in cosmetology and freaking sewage line cleaning and freaking nail painting and nail biting. They giving degrees out for everything. Why? Because if you're studying that BS, you're not studying economics. You're not studying foreign policy. You're not studying domestic policy. So when they come out and present things and use certain language, we're blind, ignorant. But you heard it from him himself. Now, I want you to listen to Dr. Oz as Dr. Oz goes into some of the alleged fraud that they found. I won't even say alleged, the fraud that was found. Check this out.
My agency, CMS, has been claiming sweeping fraud exists in poorly designed Obamacare plans. These are the exact same plans that the Democrats just shut down the government in order to prevent sensible reforms. You don't believe me? Well, breaking news. The Department of Justice charged and a federal jury just convicted 2 executives in a scheme to fraudulently enroll Americans into Obamacare insurance plans in order to obtain millions of dollars in commission payments. Because many of these plans are now fully bankrolled by federal taxpayers like you and me. It's easy to submit false applications for individuals who aren't even aware they have this insurance, right? And they're not even eligible for the rich subsidies. These scoundrels signed up vulnerable people suffering financial, mental health, drug problems to line their own pockets. They ripped all of us off. $180 million. That's what they took before being stopped by our wonderful law enforcement officers and Department of Justice attorneys, who finally brought these individuals to justice. Now, these rackets are real, and we need to fix the Obamacare subsidies that allow it to happen so frequently.
So again, as you heard right there, that was just 2 people, right? Now, I find it real funny, and you may not be able to see this very clearly, but what this is from opensecrets.org. Open Secrets gives you information about contributions to politicians, who's giving the money, who's supporting them, all of this stuff. And this is for healthcare campaign contributions between 1990 and 2024. Know who's at the top of the list? Bernie Sanders. Took in a total of $23,193,451. In 35 years, Bernie's made almost $25 million from the healthcare industry. For pharmaceuticals, 1.9, might as well say 2 million. Pharmaceutical manufacturing, 600,000. Health insurance and HMOs, 1.7 million. Hospitals and nursing homes, 2.7 million. Medical devices and supplies, 500,000. Medical societies, 12.8 million. Nursing associations, 3 million. So medical societies love them some Bernie. Next on the list is the Georgia Senator, Democrat, Raphael Warnock, with 14. No, so the next closest person to Bernie is at 14 million. Bernie's at 23. That's a $9 million difference. They love them some Bernie. After that is Elizabeth Warren at 10.5 million. After that, Ron Wyden out of Oregon, 6.7. Patty Murray out of Washington. Tammy Baldwin. So Tim Kaine at 3.3. This list explains why these folks are fighting so hard on behalf of these big insurance companies getting these subsidies. And all they're doing, listen, the fact of the matter is they weren't supposed to increase their prices, so we thought. Now, this is important. While we're talking about the ACA and Obamacare, to all the seniors out there, it's been very, very turbulent for seniors on Medicare, and premiums are going up faster than inflation. Benefits are shrinking and plans are disappearing. And in January, a lot of seniors may be shocked to find out that their prescriptions are no longer covered and that the doctors that they love are no longer in network. So don't wait and take that risk. Reach out to Chapter, the partner and sponsor of this video, because at Chapter, let their unbiased professionals help you make sure you've got the best Medicare plan available. In a free phone call that can last less than 20 minutes, you get help from these unbiased professionals, making sure that you're on the plan where you got the doctors you need and your prescriptions are covered. You can use that phone number on the screen. Visit the website. I'll have a link in the description and a link in the comments, but don't run a risk. Your health is extremely important, and let Chapter help you make sure you've got the best Medicare plan available. But you heard from the gate, from the creation, the plan and agreement with the pharmacists, with the insurance companies and the government was that, hey, we're going to tax you 40%, which really wasn't 40%. Like you heard him say, is at the regular income tax rate, and y'all just pass it on to the consumers, increasing it. And do you know how the subsidies get bigger? The subsidies get bigger by the way the insurance companies increase pricing. So if they maintain pricing the same, the levels of contribution they would have got from the government is the same. They're greedy. A corporation is designed to generate profits. It has the rights of a human, but it doesn't have a heartbeat. It is literally designed to just absorb and just gobble up profits. So to make more money, you know what they had to do? Increase insurance. Then the next year, to make more money, increase. And why do they want to make more money? For their shareholders. It's a huge racket, and Obama's all up in it. Now, let's listen to the latest investigation as Matthew Galliotti, the head of the U.S. Department of Justice Criminal Division, breaks down another breakthrough. Check this out.
We are announcing today charges against 324 defendants for their alleged participation in healthcare fraud schemes involving approximately $14.6 billion in false claims submitted to Medicare, Medicaid, and other healthcare programs, the largest coordinated healthcare fraud takedown in the history of the Department of Justice. To make matters worse, these perpetrators used the stolen identities of more than 1 million Americans spanning all 50 states to perpetrate this scheme and submit these false claims. But I'm pleased to report that federal agents intercepted and arrested key members of that organization at U.S. airports and the U.S.-Mexico border, cutting off their intended escape routes. We are announcing today charges against 324.
Jokers tried to get out of the country and they busted them. They stopped them. Now, check out this Fox News report that really goes in depth about the whole breakthrough, the $21 billion in Obamacare fraud. And if you see here, do me a solid. Leave a comment. Tell me what you thought about the Jonathan Gruber clip where he called Americans stupid and said out of his own mouth. They worded it in a way where the CBO wouldn't be able to tell it. And the CBO is they rate different things coming out. They give a report saying, hey, how is this going to impact this and how is this going to impact that? And they wrote it in a way where it would be able to be passed, given over to Congress, and Congress let it through.
Major hit to Barack Obama's legacy, Obamacare. Congress's watchdog, the GAO, found massive systemic fraud in Obamacare. $21 billion potentially in fraud in just 2023 alone. 58,000 dead people got $94 million, but Obamacare was why Democrats shut down the government last month for 43 days. They want $400 billion more in subsidies. The Senate votes next week on a Democrat plan to try to get that spending. Luke Usier from Senate Budget, Kansas Senator Roger Marshall. Senator, you've been all over Obamacare fraud. How can Democrats demand and justify more money in spending? And let's go through what the GAO found. 97,000 double dipped and got at least double or triple the coverage. Obamacare gave out coverage without requesting requesting documents. They gave out 190,000 separate instances of unauthorized payouts, fake identities. They still got Obamacare. So they were getting these tax credits with fake IDs and dead people's social security numbers and more. What do you think, Senator?
Well, the GAO confirmed exactly what we were expecting. And another example is that one social security number was used 125 different times. So as we expected, there's probably $35 billion of fraud. The reason that we were kind of tipped off is only about a third of the people on Obamacare actually filed a claim with their insurance company. So these were ghost patients. And by the way, most of these were not paying any type of a premium. They had a $0 premium thanks to the enhanced subsidies. So the bill that we dropped today is going to address these issues. It's going to require a real ID. It's going to require some type of biometrics. It's going to require those people to actually make a monthly type of payment so that they see something coming out of their real checking account.
Is it now an extinct species of any Democrat who cares about the public purse, who cares about taxpayer money going flying out the door? I mean, this is simple garden variety tax credit fraud. Tax credits, it's so easy to commit fraud via tax credits. It's basically money that goes right out the front door. I mean, Biden signed legislation supercharging Obamacare fraud, putting it on steroids. So does any Democrat exist in D.C. saying, yeah, this is bad, we got to stop it?
Well, Liz, I'm afraid you're right. So we've approached multiple Democrats to be co-sponsors to our bill. And what stopped them is that we were requiring $5 a month. We were requiring each one of these people to make a $5 payment per month to stop some of that fraud. We can't get one Democrat sponsor. So they say they want to fix Obamacare, but do they really? I think that's the question. What they really want is Medicare for all, which ends up being Medicaid for all. Again, that's their goal here.
Which means more fraud, which means fraud on steroids. I mean, this is really out of hand. We're going to be monitoring this. Thank you so much, Senator Roger Marshall.
So really think about it. Now, a part of me really believes that they're doing all of this spending and doing all of this fraudulent stuff and was trying to take money from here and there. Sometimes I wonder if the Democrats' intention was to bankrupt Social Security, bankrupt Medicaid, which is flooded with all those illegals, and really put people in a position in the next 15 or 20 years where they literally would be, those that didn't have the resources would be so broke that they would demand and be willing to do anything the government told them to do, whether it be giving up Second Amendment rights, Sometimes looking at this stuff, it looks like that to me. What do you think? Does it seem like they're trying to just bankrupt everything and just destroy it to just cripple the American people? Because it seems that way to me. Now, real quick, I'm going to jump back to this article and read a little bit of this. So, new GAO report exposes rampant Obamacare fraud. Yesterday, a new preliminary report by the Government Accountability Office, GAO, exposed rampant waste, fraud, and abuse in Affordable Care Act, ACA, marketplace plans, specifically regarding premium subsidies. With these Obamacare subsidies expiring at the end of the year, Democrats have insisted on extension and thus an expansion of Obamacare itself. Not only did GAO's analysis find improper use of the Social Security numbers to receive Obamacare subsidies, but they also found thousands of dead people receiving tax dollars, and shockingly, every fake identity created by GAO received subsidized ACA coverage. So they went in, were creating fake accounts themselves, and all of it was passing. Everything was passing. As a matter of fact, I might have an actual example of one of the cards that they had submitted. Maybe I don't, but yeah, I had it earlier where you can see they put stuff on there. They weren't answering anything. Citizenship, nope, not available. Income, not available. All of the stuff, didn't refuse to answer anything and was approved. The GAO's report makes one thing clear. We should not be spending hundreds of billions of taxpayer dollars to fuel systemic failure. In addition to a broad analysis, the GAO conducted covert operations creating fictitious identities with fake or never issued Social Security numbers. Below are some of their disturbing findings. All of the fake identities created by the GAO were approved for subsidized ACA coverage. The GAO created 20 fictitious identities in late 2024. 100% were approved. Still in 2025, 18 of the 20 fake identities are receiving subsidized coverage. This proves that marketplaces approved coverage for those who didn't submit documents and those who submitted fake documents, including fake citizenship eligibility. The monthly subsidies paid to health insurers on behalf of these 20 fake identities is over $12,300 a month. There has been rampant misuse of Social Security numbers, including a single Social Security number being used 125 separate insurance policies. As the report explains, CMS does not block new applicants using the same Social Security number. To demonstrate how this can be problematic, the report highlights a 2023 example in which one single Social Security number was used on applications for over 125 insurance policies, totaling over 26,000 days of coverage, the equivalent of 71 years. The GAO could not identify evidence of reconciliation for over $21 billion in APTC for enrollees who provided Social Security numbers to the federal marketplace for plan year of 2023. So they couldn't find anything, any reason, none, for this $21 billion for this services that never even happened. Further, the GAO identified at least 29,000 Social Security numbers in 2023 and at least 68,000 Social Security numbers in 2024 that were used to receive more than 1 year's worth of insurance coverage with APTC in a single year plan. Big insurance companies are collecting subsidies on behalf of at least 58,000 deceased individuals. The GAO found that 58,000 of Social Security numbers receiving advanced premium tax credits matched Social Security's death data. This means that roughly 94 million in subsidies were sent to health insurance companies on behalf of deceased individuals. At least 7,000 of these individuals were dead before their coverage even began. Hundreds of thousands of consumers were enrolled without their consent. The report highlights concern about agent and broker corrupt practices, specifically how bad actors are enrolling consumers through the federal marketplace by falsifying information on their applications. According to CMS, roughly 275,000 individuals filed complaints in an 8-month period regarding being enrolled in a plan or having their plan changed without their consent. Of course, these are the people who noticed. The Mirror's Paragon Health Institute's research regarding phantom Obamacare enrollees finding that a staggering 40% of enrollees in 94% actuarial value silver plans and bronze plans had no medical claims in 2024. No doctor visits, services received, or prescription filled. So what that tells you is that these people, 40% of them, never went to a doctor, never used the services at all. So how do you know that they're even real? The enhanced Obamacare subsidies have led to widespread fraud. In addition to lax verification, the new ability to have zero premium plans incentivize the improper enrollment of millions. The Paragon Health Institute estimated that 6.4 million Americans are improperly enrolled in Obamacare exchanges, a number that surged by more than 1/4 from 2024 to 2025. This level of improper enrollment, which is likely an underestimation, will cost taxpayers up to $27 billion this year in 2025. It is abundantly clear that not even the most basic controls are in place to prevent fraud in the federal marketplace. Taxpayers should not subsidize each failure. There you have it. So, now the Democrats have nothing to hide behind. You got the Supreme Court that are passing legislation that say, hey, Texas can use the maps. You got the Supreme Court that just took up the birthright citizenship case because they know when the forefathers passed that 14th Amendment, that was for slaves where they obviously, some of their grandparents and parents were brought over from other places and they were born here. And so they did that. They never knew that 25 million illegals would come across, and the Democrats would try to use that, creating the whole anchor babies thing. The Supreme Court took that up. Another thing the Supreme Court is hearing is on voter ID. So the Democrats are panicking because you shut down the insurance, you shut down the right for them to vote, you shut down them getting benefits like Trump has done. He's demanded the voter rolls from all the states. Republican states submitted the voter rolls. Guess who didn't? Democrat states. So he said, okay, you don't want to submit it? You won't get any federal money, no SNAP, no nothing. And so Trump is playing hardball because he knows those rolls are filled up with people that aren't alive anymore and illegal immigrants. And now we see can you imagine how low our insurance would really be if it wasn't for the almost $600 billion in fraud? Oh my God. Do you know that $600 billion in fraud is 10% of the government's budget for the year? We're talking about for the United States, which is around $6 trillion. So 10% of our federal budget has gone to fraud, waste, and abuse through Obamacare. So I just wanted to bring you that and let you know we're not crazy. The prices didn't have to be the way that they are, and it had nothing to do with the pandemic. It had everything to do with the Democratic plan, not the pandemic, the Democrats' plan. And you heard it in the beginning with Obama's brain, who created Romney Care, which was a smaller version, but it actually worked on a small scale. They had better regulations to make sure that they minimize the fraud. But the Obamacare was created to incentivize the fraud and use that money as a slush fund. Because guess what else? President Trump posted about it, about Barack Obama allegedly getting $2.5 million a year in royalties from this deal that he set up. Now, why would a former president be getting royalties off something that's supposed to be reducing costs? Because you may not remember, but Barack Obama had once said that, the insurance would be as inexpensive as your cell phone bill. But he lied. But I wanted to bring this to y'all. Thank you so much for watching. And as always, leave a comment. And I want to thank you from the top and bottom of my heart for watching. I really appreciate you. Thank you so much. And if you haven't already, hit that like button. And if you aren't subscribed already, subscribe. Most importantly, I want you to stay safe and you be great. I'm Brian Maxwell saying I look forward to seeing you at the top. Over and out, y'all.